Three most important points for doing safe neurosurgery. First one would be complete knowledge of the anatomy and the expected pathology of the disease that we are dealing with. Very, very, very important. Yes, something which we've read for the last so many years is obviously helpful. Apart from that, we can also take the help of something called as neuronavigation, which gives you ongoing information about where we are and what we are doing and where we are headed. So that's one. So second point would be good hemostasis. Very important to control the bleeding, not just because of the blood loss that the patient might have, but it also makes it very difficult for us to see what we are dealing with. Two things that really help us over there would be a good suction machine, which helps us to see the structures that we really want to. Apart from that, stopping the bleeding. Stopping the bleeding can be achieved with things like a bipolar. It can be done using a cautery. It can be done using other things like Abgel, Surgicel, sealants. These are things which are useful in stopping the bleeding. But the most important thing which helps us during an episode where blood is bothering us would be our patience. And the third point would be visibility. I would say visibility is the key to a good neurosurgery. And why is it so? Because if I see something very clearly, I'm very, very, very sure that I wouldn't cut anything wrong. So visibility becomes very important. The equipments which help us achieve that would obviously be a good eyesight. Apart from that would be a good microscope or an endoscope. These are things which magnify things and throw good light in the field that we are operating in. So these are three very, very important things which help us in doing good neurosurgery. But apart from that, there is one thing which is equally important, the fourth point. That would be good closure at the end of a tiring surgery. This is the point where we might actually say the surgery is done, and then the closure is one thing which we have to be very, very careful about, because a good closure can avoid so many avoidable complications. So there are 3 points and then one bonus point regarding closure. Once we do this well, yes, a good neurosurgery can turn into great neurosurgery. Thank you so much.